Hi everyone, welcome to my channel. As you all know, my channel is all about child development, mental health, and interesting recipes. So today we have Dr. Iabdhi with us. Dr. Iabdhi Mehta, she is a GP and she's based in Canberra. But we also have lots of interesting facts to know about her and what she has to share more in terms of the child development and the issues that we are facing right now in terms of the children health and awareness that we as parents need to know. So let's go to Dr. Iabdhi. Hi, doctor. How are you?
Hello, how are you going? Thank you so
Great.
much for having me here.
And it's a pleasure. Thank you. So just tell us something about yourself. Yeah, and of course, as I mentioned, I know you're based in Canberra, you're a GP, but any interesting facts that you'd like to share and your background as well.
Of course. So my name is Dr. Iabdhi Mehta. I moved to Australia when I was about 8 years old from India, and I've been living in Sydney. I did my schooling there and then moved to Townsville in Queensland for medical school, and had a beautiful experience there. And I've done my intern year residency and some pediatrics training at the Westmead Children's Hospitals in Western Sydney as well. And since then, I actually got married in March and I've moved to Canberra now. And this is where I practice full time as the general practitioner. And I'm really lucky because I absolutely love what I do for work.
That's great. And that's amazing what you're doing. So as a parent, I know from my experience and as well as the other parents I talk to, there are so many what do I say? There are so many probably issues that a child might have, which we might not be aware of. So, and what we're first told is approach your GP first, and that's because GP expertise and everything, right? So, what would you advise to parents like us?
Of course. So look, I think child health actually begins at the start of the pregnancy, I always feel. So that's a really good time, for families to try and decide who they want to involve as their GP, or whether it's a clinic or a specific doctor. And I think that's a really important decision, and one that is something that's going to affect the life of not only your pregnancy but your child. And
Right.
usually, so I myself, as a women's health GP, but also a pediatric special interest GP, I see women
Right.
straight when they start getting pregnant or starting to think about pregnancy. And I
Right.
see them throughout the pregnancy, and then I see them with their newborn. And it's really good if you have that continuity because, I would know what issues mum had in her pregnancy, like was baby a little bit premature maybe, or did they have any gestational diabetes? And those things link very nicely to a newborn period. And, I really like stepping in with parents, especially first-time parents who, may not have all the support and knowledge that, they wish they had. But it's really nice to kind of, and I think in Australia, we're very lucky. We've got the Blue Book. Each
Right.
state has a version, but there's very like specific checked milestones that you're meant to catch up with your GP and the nurses at the clinic and stuff. So, the first check was usually 6 weeks old, and that's with the first shots, and that's a really big one because the height, the weight, the first few things are done. It's the first time, since breastfeeding has been established and stuff like that. So it checks everything there. The immunizations are very important. And I find that that's a time when, as an experienced doctor who does a lot of children, all GPs, they'll be able to pick up, are they happy with how your child is going? Or is there some things that they're concerned about? Usually at the 6th week, it usually is weight related. Like some babies are maybe not feeding well and things. So, those each things. So feeding is checked, all milestones are checked. So, are they able to hold the head up right or not? And then speaking, are they babbling? Are they hearing and seeing okay? So all the checkpoints are very important. And then, there's another one at 4 months, and then 6 months, and then 12 months, and then 4 years. So 18 months and 4 years. So there's one every so often. And, at 12 months, we check for, are they saying the first words? Are they doing the first steps? And it's totally okay if your baby's not. But the whole goal of medicine is early intervention is best. So if you figured out your child is maybe a little bit speech delayed, the best time to pick that up is 12 months, not almost 3-4 years. And because you lose that time and you find the trajectory of kids, if you pick up things, the trajectory will fix it very quickly to what the rest of the kids in the age group are doing. Whereas the longer you kind of may leave it, the harder it is for them to catch up because the gap is just so much bigger. And also, when they'll feel a little bit left out of daycare if everyone else is doing something and they can't. So we always find that it's super important that you do those regular visits. And the GP is the best person because they know your family well as well, so they know, like, maybe the family's struggling through something, and so they'll be able to help you to the right resources and skills. So yeah, I think, look, the importance between a patient and GP relationship, child and family all together, is super important. And I think, yeah, starting straight from when you're thinking of getting pregnant, and then that GP, ideally, if they can see you through your child's life till they're a bit older, I think that would be really good for them.
Okay, great. So what I understand is, we should have just one particular GP that we go to, just to make sure that, because that GP would have the entire history about yourself, and also when you have a child, about the children, your background, so they can relate to, if there is an issue with the child, they could relate and then work with us to that.
Of course, like with these things, like the more context you have, the better the outcome is going to be. And I appreciate that, not every GP has the availability, or maybe they don't have all the slots. But I think if you stay within the same clinic, and usually doctors of similar like-mindedness are in practice together, like you would find very similar doctors in the same practice, even if you don't see your exact same one. But at least all the notes are in one place, all the weights and stuff are recorded in the same place. So I think that continuity will be really important, at least for the big decisions. Like a little cough and cold is different, but for the big milestones in development, continuity is definitely key.
Right. And I agree to that, because it's in the same clinic, same hospital, even if that particular GP is not available for that particular day, because I understand most of the places it's in rotation basis. So if that GP is not there, the medical history of the patient, of the child, is maintained.
Exactly. And the GP can always look back at last visit, even if it wasn't with them.
Great. Yeah, great. And that's great that you mentioned about, the mom's health and how it's related to children. If you could brief some more about it, because I strongly believe as well, and that's exactly the awareness I want to create, is how important it's for the women to take care of themselves, and how important their nutrition is, and how it relates to the child, because that stage of pregnancy and pre-pregnancy, which a lot of women ignore, relates to the child and their development. So if you could just brief us a bit about that as well.
Of course. So look, like, I think, women are amazing creatures, but the one thing they always, forget to do is look after themselves. And, the simplest way to think about it is, baby is only eating what you are eating. So all the nutrients you're feeding yourself, that is exactly the only nutrients baby's going to get. So that's a lot of responsibility as well. So, people usually say the fittest you should be is when you're thinking of having a child. So some people a little bit on the larger side in terms of weight, or stress levels are very high, or mental health is not great, or diet and stuff could use a little bit of help, like, eating more fresh fruits and veggies and protein, and, less takeaways and stuff. So I always tell people, make sure you're in a really good patch of life, and health and fitness is really good before you take that next step. And equally, mental health is as important as physical health. You don't want to put more stress on when you haven't even sort of dealt with your mental health. So optimize all those areas in your life.
Right.
And then I usually say, when you're thinking of getting pregnant, you and your partner come along, both of you get a little blood test, and we run through all the immunizations that you should have had, especially if you've not been born in Australia. Australia is very strict in what they want before the pregnancy levels. So, make sure you're up to date with all of that. Make sure you start your prenatal vitamins. That's like your Elevate, folic acid, things like that. So a lot of people are low in iron, and all those things need to be topped up as well. So just see your GP, and the GP will do a blood test and a few checks to make sure everything is okay. And then once you've got the green light, you can start trying. And then there'll be a few blood tests once you fall pregnant, but that pre one is very important. And then, eating all the healthy things, keeping your calm stress levels down. So, are you doing meditation? Are you doing yoga? Are you going for walks? What is it that you're going to do to help your mental health with that? But yeah, that will all definitely help both mum and bub.
Okay, that's great. Yeah, and we'll definitely talk more about it as well. But one of the key areas, and one of the viewers had written to me saying what they'd like to cover today, is the epilepsy. And how is it related to, again, what happens to the mom pre-pregnancy, during pregnancy, or does it happen to children while due to stress levels, or a shock, or a head injury? So, relating back to, the mental health and how mom's situation is, and the health as such. So that's where the question came from one of the viewers. So I thought probably that is something that we can discuss today. And if you
Sure.
could brief us on the concept of epilepsy and
Yeah.
seizures, what's the difference? Is there a difference? And how is it related to pregnancy, or is it at all related to pregnancy?
Sure. So I guess seizure is the umbrella term, and epilepsy falls under that. So seizure just means overactivity of neurons in the brain. There's different things that can cause seizures. One of the type is epilepsy. Other things that can cause a seizure in a child or an adult even is high temperatures. So febrile seizures can happen in kids as well, and that's when they hit high temperatures and your brain starts firing off neurons in an uncontrolled manner, and that's how you get the seizure. So fever can cause it, drugs and alcohol can cause it as well. So if your child has accidentally ingested something or anything like that, that can cause seizures. Infections such as meningitis and stuff can also cause seizures as well. And I think a few of us would know some people, whether in the workplace or stuff, that are seizure prone. So we know that if they're not feeling well, people can tell. Epilepsy is basically a branch of conditions in seizures where there's no specific cause like drugs or fevers or anything like that. It's usually a genetic basis. There is other things that can cause it, like if say there's been a big brain injury, so whether say when they were young, if they had a drowning or a near drowning, or like a big traumatic brain injury like an accident or anything like that, or if during labor there were any issues when baby was being born and the head was coming out or anything like that. So a lot of those things can cause it as well. A lot of the times it is genetic though, so you will see a lot of people have a family history of epilepsy, and a lot of the times that child is not going to be the first person that has had epilepsy in that family, whether it's dad's side or mom's side. So there's a huge genetic component. There's about 300 substreams of epilepsy and, different types of it, but a lot of it is usually genetic, or it's not genetic, but it's the way the brain was left after whatever damage, whether it was an infection or an injury. And the remaining of the brain is not as synchronized when it delivers messages to each other parts, and that's what causes the seizures. In saying that, even in seizures, there's so many different types. You've got your grand tonic-clonic, which is the classic one that everyone knows, with the shaking of the limbs and the rolling of the eyes and stuff like that. But then there's also like partial seizures where not both hands is affected, only one section of the body might be affected, or absent seizures where, they don't have the classic movements and it kind of looks like the child's daydreaming or staring off into space and not responsive, but it's actually that they're having a seizure. And it's very important that, parents know these things, because if there's a lot of things that you need to do and keep the child safe, but then also it needs to be worked up and followed up with the GP and a neurologist to make sure that, any reversible causes are fixed. And if they need medication, we can start that.
Right. Thanks for that, doctor. And one of the questions that I have is talking about, one of the factors or which could lead to seizure is when the child's born. So the forceps delivery or labor, does that have high chances of a child having epilepsy or a seizure?
It won't. So obviously the most important thing is getting a safe delivery, and the safest place is always the hospital, and so kids are usually delivered through midwives, not doctors in Australia, but any high-risk kids. And again, super important while you're doing your monthly follow-ups with your ONG and your GP to make sure baby's safe for a natural delivery and it doesn't require a C-section due to size and stuff. So it's all just risk stratification of what is going to be the safest way for this baby to be born. I think as doctors we only have two things that we want out of any pregnancy situation: healthy baby, healthy mom. We don't care if it happens to a natural delivery, C-section, forceps or things, because you have a very high risk environment and the outcome needs to be healthy baby and healthy mom. And so a very specific obstetrician will decide, is the baby not progressing? Is forceps or vacuum correct, or does it need to progress to an emergency C-section? So no, I would disagree that forceps increase the chance of traumatic brain injury or anything like that. But obviously if something gets stuck or something gets bent differently or things like that, it may. I don't think seizure in general, cerebral palsy is usually what it's called. It's a bit different to seizures. That's what usually it's higher risk of. But again, I think you have to trust the professionals. And I think the most important thing is if someone is recommending a certain route as the safest, then really taking that into account, even if it doesn't match your birth plan. Because, we all love a water birth and Zen and delivering at home and stuff. But, if your doctor says a certain thing's safest, I always say go for the safest route.
Okay, fair. So the key is listen to the doctor, right?
I think so, yeah.
And don't take your own decisions on such things specifically.
I think you're allowed an opinion, but I think there's a reason why they say things. It's not their baby. They don't care if you deliver naturally or C-section, but they can risk stratify, and you're going to an expert for a reason, whether it's the midwife or the doctor. So very important to take such a big decision in your life. Very important to take good advice from, but your input will always be seen. Like no one just decides. Someone will always ask you what you want, though.
Yes, right. I agree. Well, that's good to know. And the next question I have for you is, and what I want parents to know is absence seizure. Now, one of the seizures that you mentioned is absence seizure. Now, a lot of us have not heard about it. Could you brief us about that as well?
Yeah, so absence seizures are still the same as in the name. Seizures is when there's an overactivity or firing for the neurons in the brain, but sometimes it leads to the grand tonic-clonic, where they've got the movements and the shakes. Sorry, absence seizures is usually when the child kind of just looks like they're blacking out. They can't hear anyone. They're not really moving. They haven't fallen to the floor or anything, but they're just very still, almost like if they're daydreaming, but then you can't catch their attention back. It can last for more than a minute, usually somewhere between 30 seconds and 5 minutes. So it's not a very long period. And sometimes it can take very long for that child to be picked up, because how many kids daydream for more than 2 minutes a day? So it's a very hard thing to pick up, but always nice to cautiously, approach your child and see if they're responding, making sure they're in a safe area. So, if they're on a bar stool, or if they're going to be in the water or something like that, making sure they're out there in a safe area. I always recommend parents to do a first aid course and a CPR course, and a basic one, because putting them in recovery position and things like that is all very important as well. And then timing of the seizure is very important. So each seizure has its own thing. People who get seizures, a good GP will lead you through the whole thing. They'll have a seizure action plan that you'll have to submit to school and sports and wherever they go as well. Some people have medication associated, and the parents also. It's a very so basically, if you're worried that your child is maybe daydreaming and you're not able to get their focus back despite sounds, everything, if they've got any incontinence or tongue biting, or when they come about, if they call it a post-ictal period, where after the seizure you're very confused and you don't know where you are. If your child has that, then that's also concerning. So if you have any of these episodes, definitely go to your GP or emergency department and get it formally assessed.
Great. And I think some of the points you already covered, but again, as a parent, it's very difficult for us to differentiate between daydreaming and the absence seizure. You did cover most of the points, but how do I differentiate between these two? Like, how do I know a child is daydreaming versus absence seizure, which again would last about 2 minutes? Sorry, go ahead.
Yeah, so daydreaming, I think, is just like, are they able to be interrupted, and are they able to be, like if there was a loud sound or you call out the name, like usually if they're daydreaming, they will turn around. In an absence seizure, people feel like the child's selective listening to them, but it's not that they're selective listening. They literally just can't hear, like they're not processing the information. I think if you can find the child is daydreaming and try catch their attention, you will know. But also other things to look out for is any tongue biting, the confusion after, any incontinence, so both urine or stool, and also the tone of their body might go very floppy as well, or anything. So sometimes if they're sitting on a chair, they might fall down, or things like that as well. So I think, any closer, and we're very lucky that a lot of schools and daycare staff are also very aware. So, they're probably more likely to pick it up as well, dealing with it all the time. But just gently approach your child. But main thing is putting them in a safe position. So once the episode resolves, you can obviously make sure they're not in danger during that time.
Okay, got that. And is this type of seizure something that the child will outgrow as they grow, or should that be? I know it's important to treat, important to understand that they have something like this, but I've also heard that absence seizure is something that the children outgrow as they grow into adults. Is that
so
true?
Seizures in general, a lot of it, again, because a lot of it is genetic and a lot of it is unknown, you don't know if you're going to be the child that outgrows it or not until you've sort of outgrown it. But I think what you get better at is your triggers and stuff like that. So some people know they will get seizures if they get exhausted, if they're in bright lights or strobe lights, if they're dehydrated and things. So I think as you get older, because you know you're high risk and you really need that 8 hours of sleep and stuff like that, a lot of people can almost predict if they're going to have a seizure, because they're so familiar with their signs and they know if they're exhausted and fatigued, they can bring it on. Some people obviously can't tell. And I think you do grow out of, like, there's a Ronaldic type epilepsy, which is a childhood epilepsy, absence seizures. Those ones people do grow out of, but the big epilepsies as well, a lot of people do grow out of, but it's usually because they've controlled their triggers and they're on preventative medication, which increases the seizure threshold. So even if you were tired, normally you'd get a seizure, the medication adds a bit of a gap, so you have more room to get, like, to be triggered to get that seizure. So it's so different because there's so many different types, and even a neurologist needs to be involved. It's not even solved at a GP setting. But yeah, like I said, like, they need to make sure there's nothing else going on, so no space, brain tumor or something like that. Once all that's sorted, then a plan with medication and things will definitely help. And then you sort of pray for the best, but even if they don't grow out of it, I think triggers and stuff, once you're at least better prepared for it when it happens.
Okay, great. And what's the kind of test that's done for understanding the seizure, specifically absence seizure?
So there's a few tests done. Obviously, the one limiting factor will be the child's age and if they need to be sedated and stuff like that. So usually there will be a blood test to make sure you're not having an infection or anything like that. Then usually there is one form of imaging. So usually in Australia, it's an MRI, whether it's an adult or a child. If it's a child, they need to be sedated because you can't move during the MRI because it's a very thin slice and they need to join it all up together. Sometimes they sedate the child and do an MRI, and then a video EEG, which basically calculates the traces of the brain connections and the neural fighting, and they'll see if there's an overactivity and catch it in there. And then the neurologist, the very smart neurologist, will piece all that together and tell you what your plan is and diagnosis is.
Okay, that's great. And I think this has been such a great informative session. I mean, there's so much to know about just the concept of epilepsy. And within epilepsy, there are so many different types, which I've learned today, and I hope all my viewers have learned that as well. And it's very important for all our parents to know this. So definitely it's very informative. And just for the benefit of viewers, I'd like to say that we'll have more sessions with Dr. Iabdhi. She's going to be talking us through pre-pregnancy, during pregnancy, post-pregnancy, and all the different child developmental issues and alerts and awareness that we as parents and grandparents and people need to be aware of and work on. So we'll have more of these episodes with Dr. Iabdhi. And I hope all my viewers obviously would have learned a lot about epilepsy, and we're going to have a lot of questions in our next episode as well. So thank you, Doctor. This was very informative. Thank you again for your time.
Of course, no, I've loved explaining it to all your listeners. Wealth of knowledge, and you never know when you're running into someone that might have epilepsy on the train or something. So it's always nice to know, get your first aid, and always help out and reach out if you need anything. Thank you so much.
Absolutely, thank you. Thanks again, and see you in the next episode.
Okay, bye-bye.
Bye.